What is Medicare for professionals? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What is Medicare? Medicare is a federal health insurance program. It has three parts. Part A is hospital insurance, which provides coverage for stays in the hospital, a skilled nursing facility, home health care, and hospice services. Part B is outpatient insurance, which provides coverage for doctors, outpatient hospital care, and other medical services. And Part D is prescription drug coverage. Who is eligible for Medicare? Individuals who are over the age of 65 are automatically eligible for Medicare. Individuals who have been receiving SSDI cash benefits for 24 months are eligible for Medicare. Individuals with end-stage renal disease and ALS, also known as Lou Gehrig's disease, do not need to wait 24 months to be eligible. SSI recipients are not eligible for Medicare unless they also receive SSDI. Does Medicare Part A cost anything? There are no premiums for individuals who are receiving or eligible for a Social Security benefit. Some individuals are eligible to buy Medicare Part A, and there is a premium for them. There are deductibles and coinsurance amounts for some benefits. For example, if someone has a hospital stay of 60 days or less, the deductible is $1,184. This amount is going up to $1,216 in 2014. This is for each hospital stay. What are the costs associated with Medicare Part B? Medicare Part B has a premium. This premium is updated each year by the federal government. In 2013 and 2014, the premium for Part B is $104.90 per month. Some people pay a higher premium if their income is higher or if they are paying penalties. If an individual receives SSDI or regular Social Security, this premium comes out of their check. If not, they are billed quarterly. Medicare Part B also has a 20% copay on covered services and an annual deductible. In 2013 and 2014, this deductible is $147. For certain low-income individuals, these costs can be covered in part by the state through the Medicare savings programs. What are the higher premium brackets for Medicare Part B? As you can see, for someone who has an adjusted gross income from your IRS taxes of $85,000 or less, if they're an individual, or $170,000 or less if they filed jointly, the premium is $104.90, and it goes up from there based on your income and your filing status. What are the Medicare savings programs? These are most commonly referred to as QIMBY or SLMB. The Medicare savings programs assist low-income disabled individuals who are eligible for Medicare by paying for some or all of the associated costs of Medicare Part B. There are two programs, Qualified Medicare Beneficiaries, or QIMBY, and Specified Low-Income Beneficiaries, or SLMB. In New Hampshire, there are two SLMB programs, SLMB 120 and 135. Who's eligible for QIMBY SLMB? To be eligible for assistance under QIMBY SLMB, a person must be entitled to and enrolled in Medicare Part A insurance. QIMBY SLMB assistance is determined without regard for eligibility for any other public assistance program, including Medicaid. There are income and resource limits for QIMBY SLMB. The resource limit for an individual is $7,080, and for a couple it's $10,620. And these are the program income limits. This is for a household of one. For each additional household member, add $335 to the income level amount for QIMBY, $402 to the income level amount for SLMB 120, and $453 to the income level amount for SLMB 135. Are there any income deductions for QIMBY SLMB? SSI does not count for QIMBY SLMB. If someone has unearned income under SSDI, they will receive a $20 deduction. If an individual has earned income, then they will receive a $65 deduction, and then half of their earnings will be counted. What are the costs associated with Medicare Part D? Medicare Part D generally has the following costs: prescription plan monthly premium, copays for prescription drugs, and some programs also have deductibles. The cost of Medicare Part D vary based on the prescription drug program selected, the medications needing coverage, and if the individual receives extra help or has Medicaid. Are there higher premiums for Part D if someone has higher income? Just like for Part B, If someone has a higher income based on their adjusted gross income and filing status, they may have a higher plan premium for Part D. What is Extra Help? Extra Help is a program for low-income individuals to help them pay for their Medicare Part D related costs. To qualify for Extra Help, someone must have resources below $13,300 for an individual and $26,580 for a couple. The annual income is limited to $17,235 for an individual and $23,265 for a couple. Some people with higher incomes are eligible for limited help. You must automatically apply for Extra Help. You will not be automatically enrolled unless you are a Medicaid recipient. How does someone enroll in Medicare? If someone is eligible, they will automatically be enrolled in Part A as long as they are receiving benefits. He or she will receive notification of eligibility for Part B. If they do not opt out by replying to this notification, they will be automatically enrolled. Individuals must actively enroll in Medicare Part D. They can enroll during the 3 months prior to eligibility for Part A or Part B, or for the 3 months after. They can also enroll during the annual enrollment period, which generally runs from October through December, and coverage would begin just January 1st. They are allowed to change prescription drug plans each year during the annual enrollment period. What if my client doesn't want to enroll in Part B or Part D? They can choose not to enroll in Medicare Parts B or D. When you are notified of eligibility for Part B, you could opt out by responding to the notification, and they can also choose not to pick a prescription drug plan for Part D. But for both Part B and Part D, there are penalties for late enrollment. For Part B, the penalty is 10% of the base premium, which changes yearly, for each full year of delayed enrollment for Part B. For Part D, the penalty is 1% of the base premium, which changes yearly, for each month of delayed enrollment for Part D. If someone had creditable coverage for services covered by Part B or Part D through a different health insurance during the time that they were not enrolled, they would not have to pay a penalty as long as they enrolled during the time frame that they were covered. What happens if someone has Medicare and they have to go to work? Eligibility for Medicare Parts A, B, and D is not based on income and resources, so going to work should not impact your Medicare eligibility. You may lose your eligibility for Extra Help if your income or resources increase above the limit for the program and you are not enrolled in Medicaid. Certain individuals with higher incomes may have increased Medicare Part B premiums. If you earn enough that you are no longer eligible for SSDI, there's a work incentive known as the extended period of Medicare coverage. This allows individuals to have extended Medicare coverage for up to 5 years after being terminated from SSDI due to earnings from work. My client has both Medicare and Medicaid. How does that work? Many people have both Medicare and Medicaid. They work together to cover healthcare costs. People may find that more of their necessary services are covered with both Medicare and Medicaid coverage. Medicare Part D recipients have reduced or no-cost Part D premiums through Medicaid. They may also have reduced or no-cost copays and deductibles. What is a Medigap plan? Medigap plans are also known as supplemental coverage, and they're private health insurance plans that are intended to provide supplemental coverage to Medicare. They help pay for gaps in Medicare coverage, such as deductibles, copays, and coinsurance. Medigap plans are sold by private health insurance companies licensed by the state. They are required to follow federal and state laws, and there are monthly premiums for Medigap policies. What's Medicare Part C? This is also known as the Medicare Advantage Plan. Part C plans are health insurance plans that are run by private companies. They're an alternative to original Medicare provided by the federal government. They are required to provide all original Medicare covered benefits for Part A and Part B. They may provide Part D coverage as well as extra services such as vision and dental. Most plans will have monthly premiums, copays, and coinsurance amounts, but they cannot charge more than original Medicare for certain services, and they must limit the out-of-pocket costs. Want more information? You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. You can visit the New Hampshire Work Incentive Resource Center. You can contact the Social Security Administration or New Hampshire's Department of Health and Human Services. If you are connected with an area agency, a mental health center, or vocational rehabilitation, you can contact them for more information and assistance. And you can also contact ServiceLink because they have trained Medicare specialists.